Welcome to Local 12's Town Hall meeting. We come to you tonight from Mason Middle School, a suburb just north of Cincinnati. And obviously, if you scan the crowd, it's simple for you, I know it would be, to pick out the heroin addicts. I mean, everybody knows what a heroin addict looks like, right? Sitting next to me is Jade. I met Jade back in January. Jade, you're married, right?
Yep.
Kids?
One kid.
How old?
5.
You don't look like a heroin addict. You a heroin addict?
I'm a grateful recovering heroin addict.
How long were you addicted?
I'm still addicted today, but in recovery for 17 months.
Clean for 17 months?
Yes.
Life a little different?
Life's a lot different.
Anybody would have suspected 10 years ago you'd be a heroin addict?
No.
Nah. Because there are a lot of surprises with this drug. Surprise now is it's probably the greatest killer that we've ever seen on the streets, both in the inner city and in the suburbs, that we've ever seen. So tonight, we bring you this town hall meeting live on Local 12.2, streaming on local12.com, and streaming throughout the Sinclair Broadcast Group in Ohio. What we're here tonight is to talk about this epidemic. What are the problems, and what are the potential solutions? At the bottom of your screen, there will be numbers streaming for those who are addicts, for those who may know addicts that may need to reach out and get help. A full recovery unit listed on local12.com so that you can go there and get help. But tonight, we want to begin the process with this town hall meeting and with a panel of experts. And we want you to participate as well. We're thrilled that people have come here live. They will join us in the discussion. If you couldn't be here live, we still want you to join in the discussion on Twitter and on Facebook using the hashtag #YourVoiceYourFuture. Anjanette Levy from Local 12 will be monitoring Twitter and Facebook. She will join us throughout this next hour to talk about your questions and maybe some of your solutions. Let's get to our panel. We have 4 expert panelists. We will deal with medicine, the judicial system, law enforcement, and let's begin with the Hamilton County Coroner. Dr. Lakshmi Samarko joins us. I use the word epidemic. We in the media tend to hype things. Is epidemic too big a word?
You know, I started off objecting to that word because epidemic usually means a disease that is occurring within our communities, and this certainly fits, right? I think it is a disease. And I was really happy to hear you say that you're still an addict, because I think that's a really important part of the recovery process, is that a lot of people think that they've been treated, they're done, they've been in rehab, they're out, they're clean 5 months, 6 months, and they're no longer addicts. And then they find out that they're not as clean as they thought they were. So yeah, I do think that it's a fair thing to say that this is an epidemic, because it is across every single community, and it's across state lines, and this is something that this entire region is just struggling with.
We will get more from Dr. Samarko in just a moment. Let me introduce Major John Berkey, who has been in law enforcement for probably more than 40 years at this point, commander now of the Warren County Drug Task Force. As you and I spoke, you said we've dealt with this in the inner cities, certainly in the 1970s, back in the 1960s. We were dealing with a drug that may be 9% pure, now up to 75% pure, and those who are involved in it are dying at a record rate. Does law enforcement need to play a bigger role in dealing with the heroin epidemic right now?
You know, I don't know if it's a bigger role, but I think the role we try and play is the most effective role. What we do in our drug task force is we target primarily mid to upper level drug traffickers. So although I see the overdose death side, because I also oversee the detectives, and we end up at those also. But trying to go after those folks who are at the highest, and many of these folks are not involved in taking drugs. They're there to take advantage of those folks who have addictions, and they do a good job of that. And so we try and target those folks, and those drugs go back all the way to our southwest border states, where they're brought in by Mexican cartels primarily through motor vehicle. We have a interdiction unit with the Ohio State Patrol and the Warren County Sheriff's Office, where we are on the highways every day trying to intercept those drugs. I have people that buy drugs undercover. We have people that get involved in long-term investigations using a lot of different technologies, and we're always open for new angles, new ways, and I think we've been somewhat successful, but I can never say we've been anywhere near totally successful.
How many people in 2014 died from heroin addiction in Warren County?
24.
How many in January of this year?
6, maybe 7, 6 for sure.
It's not slowing down.
No, it's going the wrong way.
Judge Robert Peeler, Warren County Common, please. I want to talk to you about your remarkable program that's underway right now. We'll get to that in a moment. First, I want to get to how you got to that program. You had a lot of heroin addicts coming into your courtroom. Changed your life. In what way?
Well, we lost 22 in a period of 24 months of people who were under our supervision. Those are numbers, but that's 22 young people, 22 families. I was dealing with a lot of these individuals, sending them to treatment, and I thought I went in, I've only been a judge 5 years, I went in thinking that's going to make the difference, get them into treatment and they'll be better. I learned quickly how ignorant I was, and I use the term ignorant meaning I just was not educated about the disease of addiction. So I set out to learn as much as I could about it. These people stand 12 feet away from me. I could look them in the eye, and the next thing I know, the probation officer's coming in and telling me this individual overdosed. I had one individual I sent to a 6-month inpatient treatment program. She was released November 3rd, and she overdosed November the 9th. So I started trying to educate myself because I wanted to do something different.
We will talk about what's being done differently in your courtroom and how successful it is in just a moment. Dr. Sean Ryan is an ER doctor, addiction specialist. Doctors are supposed to cure. And when you have somebody come into the ER, you figure out a way to cure. You have them over long term, you figure out a way to get it done. What's most frustrating about dealing with heroin addiction right now?
I think that the reason I'm sitting here today is the reason many emergency physicians are highly frustrated. It is probably one of the most detrimental feelings as a physician in your career to see a disease, a devastating disease as this is, with little to no treatments for options for treatment. And as it currently stands, given the numbers that we're dealing with, it's just not enough. And that's, again, why I'm sitting up here today with the almost sole focus of increasing both the quantity and the quality, to Judge Peeler's point, of treatment for these patients.
I think a lot of people up here have some ideas and answers. We will get to those in a little bit. A lot of you will have questions. Anjanette Levy is dealing with some of those. Pleasure to have you tonight. Your voice, your future is the hashtag we want to use. You are monitoring Twitter and on Facebook. My guess is you've heard from a few people already this evening.
Just a few so far, Brad. We're just
Take us
getting
through.
warmed up. Yeah. Well, we have one of our first tweets, which I think is a very interesting tweet for us to start with. A gentleman named @Libertas4USA, that's his handle, and he says it's a choice, not an infectious disease. That's probably a very important point to talk about tonight. We also have some other questions from people wondering how much money is allocated for treatment of addicts and what is being done to help addicts. And we, of course, want to hear from you, your questions, your comments to keep this conversation going. You can tweet us using the hashtag #YourVoiceYourFuture. You can also log on to Facebook and post a question or post there. And we may be sharing those throughout this broadcast, hoping to get some of your questions and comments out there, get the conversation going, and hopefully come up with some solutions. Brad?
And Jeanette, thanks very much. We will get to some of the questions in the House as well. I want to introduce another special guest that we have with us this evening, Dave Logan, who's with Prospect House, probably the grandfather of recovery houses here in Cincinnati. And you're just coming back from Columbus. What were you attending in Columbus today?
Yeah, we are founding board members. Prospect House is, and I am also, of the Ohio Recovery Housing, a new organization in the state of Ohio that is part of the solution to the problem, trying to promote the idea of recovery housing around the state, and there is money set aside in the state budget for that, and so we think this is a good thing.
As recovery houses go, people will say, well, you get them in, and depending on how they have been sent to you, whether judicially or by their own volition, what's the success rate in recovery houses right now as you see it?
Well, honestly, I don't know the success rate in recovery houses. What we do at Prospect House is a combination of things. We provide treatment. We're licensed to be a treatment provider. We have 45 treatment beds, and we also have transitional housing, and we also have alumni housing in the neighborhood, so we have a footprint of about 80 in Price Hill. In our treatment program, we have done our own outcome study, and we believe we can say that 2/3 of our people are getting into recovery, including heroin addicts. We use an abstinence-based philosophy, and we believe we can back those numbers up. I don't know, honestly, if a person does not have a treatment episode or a treatment experience, their chances are worse, I think, if they go straight from the street into recovery housing. And I think there ought to be an interlude of treatment before that happens. And we want to make sure that it's a continuum of services that is being established. And I don't know if it's appropriate to respond to the tweet message.
Please do.
Yeah, it is certainly not the same sort of disease that people are accustomed to. It's not like tuberculosis or even catching a cold. It's not infectious in that sense, but neither is cancer. And nobody doubts that cancer is a real disease. It has its bona fides, and it's a genuine disease. Just because you can't catch it from the other person who has cancer does not mean it's not a disease.
Appreciate your time, Dave. Thank you for being here tonight. I want to talk about the program that we're dealing with in Warren County. So, Judge, I will send this to you. $832,000 from Department of Corrections. Am I right in that? Department of Justice.
From the Department of Corrections, yes.
So the $832,000 is to set up a program. Here's what we're going to do, Judge. We're going to send you this money, and the people that come into your program, you're going to be able to use a new drug called Vivitrol. How many people do you have in the program? Take me through where you are. Explain as quickly as you can how this program is working, how people get in, and what the success rate is right now.
Well, first of all, they didn't just send us $832,000. The program, it's up to that amount, has been authorized depending on how we do. We set up a program. My court administrator, Jennifer Burnside, is the one who really put this together. We started out meeting at the Department of Corrections, and they asked us to put this together. Then they used it as a model for a few other counties in Ohio. Basically, we start out in jail when the individuals are in jail, and we have them evaluated. We have a triage to see if they actually qualify. We then have a medical evaluation done. If everything goes well, and if they're motivated, their health permits it, and the doctor approves it, then they get a shot before they leave the jail. And then they're released almost immediately, but they're on electronically monitored house arrest for a period of no less than 90 up to 120 days. During that time, we permit them to first go to their treatment, go to see their probation officer, go to work as soon as they can get a job, and then we give them a little more freedom as we work through that program. They get their shot on a monthly basis. We have an employment specialist. We have a probation officer who works with them. They report to her weekly. They're drug tested, sometimes more than once a week. It's random. They see me once a month. They have group meetings with the whole group. Right, like I said, right now there are 28 people in the program. It's an 18-month program. It's very rigid. March 1st, we celebrated our first anniversary of the program. Of the 28 people in the program to date, we have had 0 opiate relapses.
0.
0.
Sean, I want to ask you about Vivitrol, because there are those who will say, you can't treat a drug with another drug. I don't care what program it is. I've never heard of one that's gone 12 months that's had 0 relapses. It's an addiction. It's a lifelong thing. In dealing with it as an ER doctor, your belief on the success of Vivitrol, and is this a long-term situation that we can bank on, not only in Warren County, but elsewhere? And people probably need to understand, this is money coming in. Vivitrol shots are at this point between $800 and $1,000. So I'll let you speak to that.
There's a few complex questions in what you're asking and talking about. First and foremost, what Judge Peeler is doing is what I like to describe as a comprehensive wraparound service program, which we know to be necessary to have those extraordinary rates of success. So, and just for point of clarification, the statement treating a drug with a drug is obviously completely wrong. You're treating a complicated disease with a medication. And that's part of what Judge Peeler's program is doing. In light of that, no one would ever say the ridiculous statement, I'm not going to treat diabetes with metformin. All right, so same analogy, I'm treating a complicated disease with a medication. Just to throw that out there for the 5th time probably tonight. Also importantly is the fact that, like I said, it does take, for some patients, and his population has particular psychosocial needs along with their disease process, it takes that comprehensive wraparound service for a lot of people to get better. To that end, it is expensive. So I know the question is going to come up, look at that dollar figure, is that worth it for those 28 people? Well, I know you haven't spent that much money yet, but what's important about that is the following. Number one, you're preventing the loss of life in young people who have a long life to live and could be significant contributing members of society. So there's all of that quality cost that's important. Furthermore, just for the societal cost of treating those patients for their hepatitis C, HIV, bacterial endocarditis, and all the other medical consequences that could occur if they weren't in treatment, those are extraordinarily expensive. So as I described initially, it's a very, very complex question.
Dave, I'm going to ask you to come back up and talk to this, because you're dealing with recovery houses, some who you want in recovery houses who are no longer on any drugs, whether that be Suboxone or Vivitrol. Your reaction to the success of this program so far?
Well, I think it's terrific. I'm glad to hear that they have 0 relapses. We would be very happy if we had 0 relapses, but I think relapse is also conceptually, at least in my mind, a feature of the disease. We're not surprised if a person has a relapse. We don't do anything but help them begin again. And I think that if you can manage an abstinent recovery, that is without another drug called Suboxone, which operates in a very different way than Vivitrol. Vivitrol, I believe, is an effort to prevent the craving for the drug. Suboxone is a kind of an opiate substitute, and these are 2 different animals. But I believe that the recovery that you gain if you work I'm a person in long-term recovery myself, and I believe that the recovery that you can maintain will be more resilient, and it won't be as dependent upon the pharmaceutical industry. So we have more confidence ourselves in what we are doing and have been doing for 45 years now. I wish we had no relapses, and I wish we had no deaths, but our heroin addicts do as well as the other addicts do in our program. But if they relapse, the consequences are much more lethal.
Dave, thank you. Lakshmi, I want to go to you real quickly, because I want to go through some numbers. I was on the Buzz radio station this morning, and the first question was, hey, you guys are doing a town hall meeting. How come you're doing a town hall meeting in Mason? How come suddenly when we see some things up in the suburbs, people are interested in talking about heroin? Hamilton County numbers. You can correct me if I'm wrong. The ones that I have. 2013, 85 deaths from heroin. 2014, 49 deaths from heroin. If you go to Warren County, you're dealing with 2012, 11, 2013, 16, 2014, 24, and 6 more in January. Numbers can be askew. Should we worry more that this is out in the suburbs, or is it the same thing as what we're dealing with in the inner city?
So I'll correct your numbers first.
Do.
So the latest numbers are in 2014 for Hamilton County, it's 84. In 2013, it was 85. So pretty much the same. And that's heroin only. But if you go to the numbers where heroin was involved, which includes fentanyl and any prescription drugs, then we're talking about 181 and 177. But overall numbers, 2014's overall drug overdose deaths in Hamilton County, 298. That's a huge number. And you're thinking, well, it used to be a smaller percentage were heroin or heroin related. Now it's becoming the majority. And you can't look at it as, is this a suburban problem, or is this an inner city problem? It is a region-wide problem. And like I said before, it crosses the river, it crosses the state lines, it crosses the county lines. We're seeing it in every community. Is it more prevalent in the rural areas? Is it more prevalent in the inner city? If you look at the breakdown of numbers, it's sort of spread all over the place. And we do have a map in our office where we kind of map out where some of where we're seeing the addicts that are dying of overdoses, and it's all over the place. It's not in any one particular neighborhood. And having it here, I don't think is particularly symbolic or saying that we're not paying attention to the problem in the inner city. I think what we're trying to say is it is as much of a problem in the suburbs as it is in the inner city. And I do want to say one thing about the tweet, that this is a choice and not an infectious disease. It is a choice. It starts off as a choice. And that's why we're all up here to say treatment is one part of it. But if you don't have that wraparound approach, which means multifaceted, you start off with prevention and go all the way through treatment, and in between have law enforcement and everybody in the community battling this, you're never going to win this battle. You're never going to win it if you don't have all aspects of it. So prevention is a huge part of it, because as you're treating the addicts and as you're preventing the overdose deaths, don't create more addicts. And that's why prevention is a big step. So yes, it's a choice that was initially made, true, but it's an addiction and it's a disease.
Major Berkey, I want to, before I get to you, I want everybody in the audience, you are welcome to participate. I know that there are things running through your heads, so those who would like to ask a question or get up, please line up back here behind me, and I will take you in that order, and we'll get ready for those. You can line up here. And Maggie, stand up real quick and let them know you can stand up behind Maggie, and I will wander over there as well. Major, I want to ask you, people may have just wandered on this and say, okay, I'll watch this for a second. I don't know anything about it. And I'll tell you, when I started on this, I didn't know much about heroin. So everything kind of blew my mind as I began to get into it. Availability, let's say you're out in the suburbs, we're out in Warren County, we're out in Mason. How do I find it? How can I get it? How much does it cost? Who's dealing? It isn't this necessarily clandestine thing anymore, isn't it? I'll let you speak to that.
Warren County is, there's a lot of uniqueness in Warren County. It's a great county, but we sit sandwiched between two large urban areas. We have great expressways, and we have a population that is relatively affluent. Not all of the dealers by any means live in Warren County. They float in from Montgomery County, from Hamlin County. They're in and they're out. Some of our people will go to other counties. Availability is not an issue. There's tons of availability. It just depends on being in the right culture, or wrong culture, I guess you might say, and being able to access it is not a problem in Warren County. It would have been 5 years ago. What I saw change was And I don't think it's a coincidence, but the drug OxyContin was reformulated in 2010. And about 6 months prior to that, you could see cheap heroin begin to come into our area. And I don't think that's a coincidence. I think that's good entrepreneurs in Mexico understanding and being ready for a market. You know, once, if OxyContin becomes less desirable, and it certainly has, it doesn't solve your addiction issue. You move on to something else. In this case, I think in a lot of those folks was heroin.
Dr. Ryan, we talk about this as inner city, and Dr. Samarco addressed that. Coming into your emergency rooms, is there an outline of race? Is there an outline of person that's walking into your emergency room now?
Yes, and actually I want to speak to that, but just one comment I wanted to make is to all the law enforcement that I've been interacting with over the past couple of years, I did want to speak to the fact that law enforcement have been some of the most passionate and compassionate members of the community that I have run across. And I just always want to thank them and the guys back here that I've been hanging out with a little bit in their efforts and in their support of my efforts. So I just want to throw that out there.
You bet.
To your question, yes. Statistically, this has become, in this epidemic, remember, depending on how you scope the years, more of a Caucasian problem. Why is that the case? There are a lot of theories as to why that actually is occurring. Was it the preceding dependence upon opiate prescription drugs? That was part of it. Is it the fact that the cartel specifically targeted suburbia because it was a little less dangerous area for them to deal? That's part of it. From my perspective, it doesn't really matter. This disease crosses all socioeconomic boundaries. I've treated patients of all races, of all class of financial background. I have colleagues who have unfortunately suffered from this disease, and I've lost friends. So to me, it doesn't really matter, other than the fact that I may or may not see a few more of one color of person that comes in the door on any given day.
Doctor, thank you. All right, we'll start with the audience. We'll try and move through. Make your questions pointed as quickly as we can, and we'll move through. Introduce yourself, please.
My name is Tim Gibson. I live next to a heroin dope dealer, and his girlfriend works for Hamilton County for pretrial. Their sentencing has been smacked on the hand. He was sentenced before, went to prison. He got out, dealt heroin and cocaine. Now he's only serving 4 years. She gets 6 months, non-reporting probation. Our system is broken. If you get rid of the dope dealers, you get rid of the dope.
All right, Tim, I don't know whether that needs to be addressed. John, maybe you want to deal with that. Penalties from what we're dealing with dealers, and is the judicial system and law enforcement effective right now the way you see it?
Well, you know, when I first said I've been around a very long time, there were laws in Ohio that when you were arrested the first time was one penalty, and a repeat offense for trafficking or whatever, those penalties were increased. And that doesn't really exist anymore. And I think in a lot of ways the judge's hands are tied to a certain extent when it comes to, unless you get into very large amounts. That's what really drives our judicial system as far as bigger penalties.
All right. Before I get to the next audience member, I want to bring up Dan Malloy. Dan, if you could stand up here. Excuse me, sir. Thanks very much. Can you speak to this at all? Dan Malloy, please introduce yourself.
Dan Malloy. I'm with Colerain Township. I'm Director of Public Safety.
Do you have a response to the way this law enforcement is going in punishment in dealing with the addiction and dealers?
I have to tell you that I'll go along with the judge, as I've educated myself more into what the problem is and understand the disease. It's not as simple as placing them in jail. There's a larger scope to the problem that's important for us to understand as we deal with the problem. It's a problem that takes a greater response from all parties, law enforcement, the recovery people, the judge, the criminal justice system. We have to work together and understand what we're dealing with for the long term, the larger scale. Just to be able to put some away isn't solving the problem. As he just said, he got out and there was an issue. Got out and there's a repeated offense. Where are we missing something there? Why are we not dealing with it and addressing with it? It's a difficult question to ask, but just to say, okay, prison, obviously that's not working. Jail is not working. sometimes they put themselves in a situation where they have to be responsible for their behavior. No one's saying that that's not true, but we have to look at this in a greater depth and understand the scope of the problem requires all of us to care a little bit more, all of us to educate, and as the judge said already, what I was doing before was not working. So I need to look at this in a much, much greater scope and understand that I need to be a part of the solution, not continuing the problem.
Dan Malloy, thanks very much. Appreciate your time. And Jeanette, I know you've been scouring Twitter and Facebook. My guess is you're getting some more responses. Share them with us if you would.
Yeah, we are getting quite a few responses, Brad. The first one comes from @DrewMar77. We're going to put his comment up on the board, and this is in response to the question about whether or not law enforcement needs to be more involved in the fight against heroin. And he says, no, they don't. They stopped pain pill abuse, and every person in suburbia went to dog or heroin. The next comment is from Carol Burns. Her handle is @CincyFlash5. She says, my daughter has been on heroin off and on for the last 12 years and is in jail right now. And we're going to hop over to Facebook. We're going to hear from Jip Rose. She asks, are you going to crack down on the doctors who are handing out prescription painkillers like candy that many times later lead to heroin use? And we, of course, want to hear from you. We will share your comments and your questions on our Facebook pages. We want to hear from you on Twitter as well. Use the hashtag #YourVoiceYourFuture, and hopefully we can get your questions and your comments on the air and get some answers. Brad?
And Jeanette, thanks. Judge, Dr. Ryan, I can probably go to both of you on this cracking down on doctors. Hasn't that happened already, and isn't that part of the reason why heroin is more popular than it is right now because of the laws on doctors? And I'll start with you, Dr. Ryan.
Absolutely, there have already been sweeping changes in prescriptive guidelines for physicians, mostly guided by the state medical board and state pharmacy board, which have helped us to direct our prescribing efforts. Every specialty is having their own discussion about where is the appropriate prescribing, and just so everyone understands, 98, 99, 99.9% of physicians are not out there handing out drugs like candy. There were definitely a few physicians, specifically in this region, who were doing so. But the vast majority of physicians were just trying to do their job to take care of patients' pain. And at this point, there's further work to be done in the comprehensive solution that's addressing this issue.
Okay, Judge, anything on that?
Well, a couple of things. First of all, I'm not sure I agree from what I see and from my own personal experience. I've been to the doctor before and had a bottle of 30 Vicodin or whatever it is given to me for something that I needed for 2 days. What I did was put them under my sink thinking I might need those someday. And I think a lot of people do that, and their kids are finding them, their kids' friends are finding them. I really think the physicians need to share in the responsibility to some degree here. 50% of the people who are addicted were introduced to opiates by their physician. I think addiction education needs to be a bigger part of the medical training. The addiction psychiatrist and the addiction specialist are clearly not in the group I'm speaking of, but I think as a rule, I'm an educated person, and I'll admit I was ignorant to it. I think a lot of doctors just don't pay enough attention to it. Someone goes in and they complain of a neck strain, a shoulder strain, and a lot of the people that I deal with have done that, a migraine, they give them opiates. I think something has to change there.
All right, Judge, thanks. Ron is coming out from the audience. You are a recovering addict?
Yes, and I'm the founder of Celebrating Restoration. I'm going to disagree and agree that it is a choice, if that makes sense. Being a recovering addict, due to my severe depression, I did make that choice to pick up weed. And I did become a recovering IV meth addict, but I didn't choose to take heroin. Someone swapped that dope out and gave me heroin against my knowledge. And again, for those that are suffering from back injuries and other illnesses, they did not have a choice when they were prescribed Oxycontin, Vicodin, Percocets, and those things. And I'm working with a guy right now who suffers from back injury who is addicted to heroin because he was prescribed Oxycontin. So with that, I would say to agree, it's a choice, and to another degree, it's not a choice. for us as we become addicts. And it's a struggle because even with my depression, my severe depression, that lowered my inhibition to make good choices. So in that state of mind, although I did make that choice to pick up, I wasn't able to think rationally because of that illness of depression. But today I'm 2 years and 8 months sober because I got myself into recovery because someone did shoot me up with heroin, and that was not my drug of choice.
All right, Ron, thanks very much. If we're judged talking about a program that goes with the success rate that this has, and I don't know whether you get to 18 months and you're still perfect on the scorecard, whether or not that sends a message to the rest of the country. If we do send a message to the rest of the country and we don't have $832,000 to throw in each community, what's the answer? If this is a success, where do we take it next?
Well, basically, the time period that we're talking about enables the brain to heal. You have to realize and recognize that this is a disease it's a brain-based disease. And our brains, the best way that I can describe it from my experience, first of all, the brain does not want to let go of this drug. And before I had my children, I had no idea I could love them the way I do. But once I had them, I was not going to let go of them. And the reason is my brain is sending an impulse telling me to never let go of that child. That's very similar to the way the brain operates for opiates. The brain actually has a receptor for opiates, and that's what the drug that we're using in our program does. It blocks that receptor to where you couldn't feel the effect of opiates if you wanted. So you have to understand the nature of the disease.
Judge, thank you. I'm on the other side now. You want to introduce yourself?
My name's Joe. I'm a grateful recovering addict. Basically what I was going to say is I got injured when I was 16 years old playing football. I was given opiates. I didn't think anything could hurt me that the doctor gave me. By 19, I wasn't allowed to have the pain pills anymore. I was already addicted to them. I tried heroin for the first time. I'm 34 years old. I've got 9.5 months clean now. All that time, it was between pain pills and heroin. I want to know, is there any way that we can put something into schools for kids? Because I was told that because I'm an addict, my children have a better chance of being addicts. My dad was an alcoholic. So what I want to know, is there any plans to put something into schools to talk to kids about this before their friends or somebody on the corner talks to them about it first?
Joe, thank you. Who would like to take that?
I can.
Dr. Samarco?
So I think it's a great idea. That's actually a big part of what we're doing. I'm with Prevention First, which is a group that really does concentrate on educating everybody, but especially the children. And the coroner's office, we have a program we put together. It sucks the kids in with a little bit of CSI talk and they start paying attention, and then we move right into why you want to stay away from drugs. So stay away from drugs, stay in school, and stay alive. And that's really the bottom line message. And so we try and show them some images, things that drugs do to your body. Do you really want your body to look like this? Is this what you want to look like? Is this what you want to end up looking like? Do you want to end up in the morgue instead of graduating from school? And these are the kind of messages that we're trying to, it's not a scare tactic, but really it's listen, this is a serious problem. Don't go down this road. Don't go down this road because it's so hard to come back. And you'll spend years. And if you're one of the lucky ones, you'll make it back. But if not, then you end up being one of our statistics. And the last thing you want is to be one of our statistics.
Are the programs universal? Do we have them out enough within the schools? Is there money that's holding that back? Are there bodies that are holding that back because we don't have enough people to go into the schools? Where does it stand right now?
You know, we have responded to every school that has contacted us and asked us to come and give the talk. And we've actually gone back to several schools that have asked us to come back and give the next year's class talks. We're trying to work with some of the school administrators to put something a little bit more universal together. We've tossed around the idea of doing a video, but we find that it's being there physically, standing there, answering the kids' questions, and talking to them personally is more effective than them watching a video, because they get that on TV.
Yeah.
So yes, we'd like to have more people involved and more people able to give that talk.
John, we've talked about DARE. I mean, DARE is the popular thing. Does it work? Does it work? Will it work with heroin?
Well, you know, there's been a lot of controversy about DARE, and we have DARE in Warren County still. And I've always been one of, and I definitely agree with the doctor, prevention is so important. And I guess I've always been not be a proponent of getting rid of DARE unless you can show me something that's as good or better. The DARE does provide help, and there's been a lot of people that have been helped during DARE. It's undergone a lot of criticism, but the doctor pointed out before what is absolutely a must, and that is it takes prevention, law enforcement, and rehabilitation to even come close to approaching this problem. If anybody says they have the total answer, you need to go somewhere else.
We may have an audience member that wants to join in on that across the way. We'll do that in just a moment. But first, I have another doctor with me. You introduce yourself.
Hello, Dr. Will Sawyer. I'm a solo practice family doc in Sharonville for 29 years, and addiction is a disease. All right, let's all accept that. Number two, doctors are involved, absolutely. Number three, the unintended consequences of what the state medical board did dramatically increase the heroin epidemic problem. We all need to work together. Here's what I want. I've said this for 29 years in Sharonville. I'm a family doc taking care of patients, and addiction's a human issue. I want the justice system to communicate with me when we have a problem, because I might be taking care of them. Why is there no communication going on? Accountability works for every one of us. So
you're allowed to clap.
Yeah.
You see the breakdown. You've seen the breakdown for as long as you've been practicing?
Absolutely, and I've gone down, and frankly, Sharonville had their clinic or their court system there, and I'd go downtown for some kids and help out and say, let's talk about all this, whatever the issue may be. Now, I agree, docs are way too busy. You know, they may give you 30 of Vicodin instead of what they should have listened to you, but they're running on a treadmill. Let's help the physicians know. Don't penalize them. Don't say, if you do this, I'm taking your license. Docs are running scared these days. There's no communication going on between the state medical board and others because of that fear. Let's empower physicians to take and coordinate care for patients in our community, because it's in all walks of life. The only reason it's up right now is because we're getting older. Addiction, it's in grandma's cabinet. It's in other people's cabinets. It's available in OxyContin. They're very addictive substances, and you don't start. Cigarettes is the example. If you never tried it, you don't know what you're missing. It's an addictive substance. We've learned 50 years, we've tried to learn. Let's do it different. Please communicate across lines. Dr. Ron, you make these guys communicate with docs. Don't scare us. Don't do the pharmacies. Don't scare them. We're out here to help patients and people and keep our community healthy and talk about it. Let's elevate the conversation.
All right, Doctor, Judge, does that end up going to you, or Dr. Ryan, you want to go to the?
One quick point. I did want to elaborate a little bit further on what Judge Peeler said.
Okay.
Realistically, we did have some responsibility in this, and those that know me know that I'm kind of the first to step up and say that. It is a little challenging, to be honest, to say that in a public forum, because I'll probably catch some fire for it. Those who know me well also know I probably don't care about that. Realistically, we had a hand in this. We are working across through the state medical board. There do need to be increased educational requirements. There do need to be tighter regulations, but again, with assistance, not with punishment, because that's not an effective way to motivate an educated population. We all know that. I actually was a member of a four-member paper that was published basically addressing the issue of the fact that we have to claim some responsibility and then step up and serve the public like we were meant to do in the first place. So I agree with both of these gentlemen, and we have a long way to go.
Judge, anything you want to say on that?
Not exactly on that, other than some of the other points that have been raised. 30 years ago, the population of Ohio was similar to what it is today. 30 years ago, there were 9,000 people in prison in Ohio. Today there are 52,000 people in prison. A real misconception is that drug dealers or drug users are violent people. 85% of the cases I deal with, and I've sent people to prison for life. I've sent people for very long terms. But 85% of the people I deal with are nonviolent, low-level offenders, mostly users. Even the dealers are users. I almost never see a true high-level dealer. With this particular drug, it's very difficult, and I think Commander Berkey will agree, it's very difficult to catch the people who are really at the top. So when you're thinking about dealers, you're referring to people who have just enough to sell to get enough for them to use. We are trained, we have a lot of training, the common pleas judges. The Department of Corrections is there every time, and they're telling us what you've been doing the past 40 years is not working. You can't incarcerate your way out of this. You can't arrest your way out of it. Now, enforcement is a vital part of this, but to think that locking people up is the answer is just wrong.
All right, we have it. You have something that you know is on the books that you'd like to share. Introduce yourself, please.
Hi, my name is Carol Baden, and I run Community Recovery Project and People Advocating Recovery, Southwest Ohio. Ohio House Bill 367 that was introduced and began effective this January requires prescription drug abuse education in the health classes in every school in the state of Ohio. And this was passed for exactly this reason, because we all know that the beginning of this heroin epidemic started with the overprescribing of the opiates. They're available, they're in everyone's medicine cabinet. They were legitimately prescribed, as well as people who were not taking them legitimately. Regardless, this is where this epidemic began. As long as that overprescribing continues, we are fighting a losing battle. The heroin's there, the pain pills are there. It's starting to get down into the 10, 11, 12-year-olds. With the efforts and organizations that we've been doing, I've been working with 3 school districts very heavily. They all want to be involved. I would say nobody signed up for this. Not law enforcement, not medical. Nobody saw this coming. So it's time we all started gathering together, and this energy that's here needs to be driven towards finding the solutions, which we are all working towards, but we need to organize that. There's someone here tonight who lost her son 10 years ago to an opioid overdose, a heroin overdose. And this morning she said goodbye to her grandson from the same thing. That is wrong. So it's time we started finding the solution, because there isn't any more time to waste on this.
Thank you. Thank you. Commander Berkey, if we talk about those dealers, are we looking in the wrong direction if we say, hey, we're heading out on this war on drugs, and we're going to go after this heroin thing. We get some of those dealers, and we're going to head it off. Misconception?
Well, as I go back, there's no one answer to the problem. And the judge points out there are different levels of dealers. There are people that are certainly addicted, and they go to more urban areas, get their product, come back, sell enough to be able to use themselves. Those people are one faction. Those people also buy from people higher up. And that is typically our goal, is to get to that top rung. And so those people, we may buy from those people and then try and flip them on the next level, and with the attempt to get to the top. Those people that we deal with who are at the top are not addicts. They are typically, I would call them entrepreneurs. They're smart enough, or whatever, don't have the propensity for addiction, perhaps, that the people that they prey on, and they profit. And those people, in my mind, are the very scourge of our society. And they're the ones that need to be locked up and send some kind of message. It's not the only answer, but it's part of the answer.
Let's get some more social media reaction on Twitter and on Facebook. And Jeanette, what do you got?
Well, Brad, we have quite a few responses here. Some of them are just comments. One of the first questions we have is from Noah, and we'll put this up on your screen. He's on Facebook, and he asks, what is the average age when someone gets first addicted to heroin? Then below him, Rhiannon said, I'm watching right now because I've lost someone I love dearly to this ugly disease. I don't know what the solution is, but one has to be found soon. Too many have died already, and before those numbers become any larger, something has to be done. Now let's switch over to Twitter. We have a couple of comments there. The first is from @nwilson74, and she said, people need to be more educated in methadone. Then we move on to Leanne, and this one is incredibly sad. Her handle is @GCountry1207. She said, I'm new to tweeting. I need help. I'm a mom of 2 heroin addicts, one in prison and one I'm afraid I'll find dead. And hopefully we can help Leanne with getting hooked up with some resources to help her with her kids and maybe some information that could help her. Again, we want to hear from you both on Twitter and on Facebook. Use the hashtag #YourVoiceYourFuture, and hopefully we will share your comments and your questions.
Anjanette, thanks very much. I want to get another recovering addict, Matt, that I dealt with and met back in January as well, and has spoken so eloquently about the hell and back that you've gone through and are now employed in recovery. Take me through this as we hear some of the questions of when does this start? How young does this start? What's the average? It's gone through your family. You've dealt with it for quite some time. Are you taking anything out of this as you listen to all of this and you hear it almost every day now? Where are we going, and are we doing the right thing?
Well, I believe from my experience that there has to be a multifaceted approach to this. I've watched addiction rip through my household as young as when I was 10 years old, and we found my grandfather dead in our house from alcohol. I started at a very young age. But before I ever picked that first drug up, there was something very different inside of me, and I just always craved more attention, more gum, whatever it was. It didn't quite matter. So what I get to do now is know that without medication, without drugs, without replacement therapy, but with a community of like-minded people, we get to empower ourselves as recovering addicts, as recovering people. We get to humanize this disease, and we get to humanize recovery, and we get to broadcast it to the nation. We get to bring our hearts and our souls to other people and let people know that there's a life out there. It just blew my mind. I didn't know it existed. I remember waking up praying for death and not being able to stop using. And my life has surpassed my wildest dreams. I remember my wife used to say, where there's breath, there's hope. So please don't give up hope.
Matt, thank you. I appreciate it. I'm going to go to our next. We're running short on time, Marty, but tell me what you want to share.
Yes, I know several people that have passed away from heroin overdoses. Now I got me a canine drug detection dog. I go to people's houses. I'll find them narcotics. Tell the people where they're at. They can get their level and help. So many people, at least that I talk to, are in denial. They say, oh no, my kid's not on drugs. If you got a kid or a brother living with you or just a friend, me and my dog comes over, I'll tell you if there's a narcotic in that house. And if it's your loved one, you want them to get help. I know of people that put a needle in their arm of heroin and they're gone, just like that. So the name of my company is Tri-State Drug Solutions. I do Ohio, Indiana, Kentucky. My dog is very great on finding narcotics.
All right, Marty. Thanks very much. We are running short on time, and I want to get to more folks. I know that there are people waiting. I want to get some final comments. And Dr. Samarco, I will start with you. Have we made any progress, or are we losing ground right now?
Well, I think the progress is made that we're having this discussion, and that so many people are paying attention, and it's not just an inner city problem, but it's a suburban problem, a rural problem as well. And I think the fact that we're raising awareness, having people look out for each other, and looking into prevention as well as treatment, I think those are all progress. So I don't think you need to pay attention to, don't look at the numbers from my office and say, we're not making a dent. We're starting to make a dent because we're educating.
Commander Berkey.
Well, if you look at our numbers, which I know the doctor just said not to, it doesn't look like we're making much progress. I think we are having an impact, though. I really do. Like you said, this kind of forum is a great thing. I just wanted to mention one thing that we kind of touched on. We're all up here in the business of being involved in collaborative damage. And there's a huge amount of collaborative. You touched on a few of them, the crime situation and all the things that go with this. And when we talk about a shot that costs maybe $800 a month, I would beg to say that the average addict causes far, far more in not only dollars, but in other kinds of collaborative damage. And I'm a big fan of Vivitrol, not because Judge Peeler's involved, but I was before that. And I think it works. And I think, yes, it's expensive, but it's pay me now or pay me a lot later.
Judge, you called yourself ignorant to begin with. What would you call yourself now?
I think we're making progress, but this is a complex issue. The more you address it, the more you realize just how complex it is. You can't focus on one particular area. What everyone is doing is important. Prevention is key. It's long-term, though, and we also need some short-term answers. I see people who are hopeless. I see people who are helpless. I see the despair on their face. Now I see people who have hope again. I see people young women who are wearing makeup for the first time in 6 months or 7 months, who feel good about themselves. I see people who come in now who stand erect, who feel good about what they've done, who they are, and what their future holds. These are all addicts. The important thing to remember is we're not going to solve it in one particular area, but the answer is out there, and we just have to find it.
Dr. Ryan, in 30 seconds, a final thought.
I think the most important point has been made across this panel here. It has to be a collaborative, multifaceted effort. It's an extraordinarily complex disease, and it's going to take all of us working together to make a real significant impact over the next few years, which has to happen.
Panelists, thank you so much. Yes, absolutely. We are not done. We are done for television here very shortly, but we're going to stay here for the next half hour. We're going to continue to stream on local12.com. So keep your questions coming on Twitter and on Facebook with the hashtag #YourVoiceYourFuture. I want to thank the Mason Middle School for making this available to us and allowing us to come out to do this town hall. To our General Manager, John Lawhead, our News Director, Kirk Varner, of course, to Doug Lillibridge, who is our producer, and Todd Merrington, our director of this, and to all the crew that has put in countless hours to make this happen, to all of you who came out, to all of you who've watched. We thank you so much for joining us on this town hall. We're going to make progress. We're going to create hope, and we'll see you online in just a few moments. And we are back on local12.com. So we continue. How's our first hour going? Are we okay at this point? Great insight from so many. We appreciate all of you being here. So we'll go to our next audience member, who is Adam. Adam, what would you like to share with us?
I'm Adam. I'm one of the co-founders of the Cincinnati Exchange Project, and we work with prevention and recovery and treatment, but I haven't heard it talked about at all tonight, the idea of harm reduction and keeping people alive that are already using, making sure that they don't get infections, and then they can get into treatment. I just haven't heard about it, so I'd like to hear what the panel thinks.
Who would you'd like to hear from everybody up? Who would you like to ask?
Anybody.
All right, anybody. All four of you up there, who would like to take any of that?
Can you repeat that, Brad?
Repeat the question, please.
I'm just wondering what people on the panel think about harm reduction, about the idea of helping people that are already using to stay as safe and healthy and alive until they can access treatment.
So I think if I understand correctly, you want to talk about the infectious complications, possibly, and what are we doing to try and keep addicts alive while they're using until they can get into a rehab program or a recovery program.
Is that right?
Yes.
Okay.
So Dr. Ryan and I have talked about this before. We've been talking about how do you make naloxone, Narcan, available more broadly so that it can be distributed to addicts, families, addicts' partners, people that are going to be near them without going through EMS, without going through getting a prescription. And just to let you know, yesterday House Bill 4 did pass, and Narcan can be distributed without a prescription to save lives. So that's number one.
We probably, because we really, in an hour, I'm shocked that in an hour we didn't get to Narcan. And we
you
probably,
didn't ask, Brad.
I know, it's my fault. I blame me. And Narcan, probably most of the people here may know about Narcan. And I will take whoever wants to start on Narcan so that we can start from ground floor. People are going, I have no idea what you're talking about. Narcan, naloxone, what we're dealing with as a heroin lifesaver. Whoever up there would like to take it and where we go. As you say, the bill is passed, Doctor. John, do you want to talk about it at all? You can start us off.
Well, the bill did get passed to allow law enforcement to have naloxone. And, EMS have been using it, and emergency rooms have been using it for a very long time. We're in this situation where, and I guess most people don't understand, but law enforcement oftentimes will go to an overdose. And we may be the first ones there. And depending on the squad's availability, and especially in the city of Cincinnati, and out here where it takes longer, we may literally be in a position where we watch somebody die because we have no tools. And with the naloxone bill and the ability for law enforcement to now use that, we have that opportunity to save lives. And I think that's a really good thing. I spent a fair amount of time trying to help get that bill passed. There's a study in Lorain County, I don't know if you're aware of it, that the Drug Task Force did. And in 3 months, they had 36 overdoses, and they saved 32 of those 36 is because the cops had naloxone. It kind of speaks for itself.
Dr. Ryan, did you want to say anything about it?
Sure. It's a very important part of the comprehensive topic. I myself am working with many of the community agencies, particularly the Cincinnati Police and the Hamilton County Sheriff, to further expand the programs throughout this region because of the importance of the fact that the law enforcement are often, the first arrivers. But to back up from that, just so everyone understands, the reason that the House Bill 4 was so important is because the first person that arrives on the scene is often friends, family, other that are very close. And so to that point, it was extremely important that we do community distribution throughout so that the access to that life-saving drug is broad.
All right. Introduce yourself.
I'm Michael, and I'm a person in long-term recovery. I felt urged to get up here and talk. I feel like I remember what it was like to be, addiction is killing your neighbor. It's killing fathers, sons, children. It's all over the community, and it's getting, I would say it's getting better, the healthcare system. We talked about treatment and preventative care and prevention and harm reduction. 8 years ago, I remember my mother driving me all over the city because it was either go get me more drugs, or it was try to find me help. She did that for me and my brother, and we were turned down by every emergency room. We were turned down and told there was a 30-day wait or a 6-month wait to get into treatment. We needed $10,000 cash or $50,000 to get in. Now that has gotten better in the past 8 to 10 years. As a result, we did lose a family member. My brother overdosed at 19. I made it through that, but I just think it's my obligation and my duty to get up and cause some public awareness and bring the issue forward that I found a way out. And I can recover from this. And I feel like the only way that our community is going to recover from this is by community awareness, and that's from the healthcare end, and that's from doctors, and just the whole community needs to be aware of it. And I think at that point, instead of attaching a stigma to it and trying to use scare tactics with younger children in high school, we need to I think we just need to bring them awareness and let them know this is real and this is killing people and this is not how you want your life to go. So I think prevention's a big thing, and I just wanted to voice my opinion and say I found a way out, and if I can do it, anybody can do it.
Well, congratulations. Thank you. Hey, throw that out. I guess this kind of goes back to one of our first tweets, doesn't it? That we have a perception that if you say the word heroin and you say the word addict, I don't need to deal with that. It's somebody that I'm not going to know. It's somebody who's making a bad choice. I ask in this perception, if we're dealing with heroin governmentally, is the money coming to the point that will create the type of solutions that all of you up there on the stage are getting what you need monetarily to attack this problem? I'll let whoever wants to start. Dr. Samarco.
From a coroner's point of view, from a crime lab point of view, no. But I'm not sure there's enough money to address everything, every aspect of this. But we're all certainly trying, and more help we get, I think the better we do. But, you know, for us, the number of drug submissions that we're getting to our crime lab and the number of drugs that we're processing has skyrocketed. And it's not just heroin, it's all the drugs. And we're still seeing a lot of prescription drug overdoses. So let's not forget, I know heroin's getting a lot of attention and it needs the attention, but there is still a huge prescription drug addiction and overdose problem in our region. It's not something that's gone away, and it's not something that's going to go away, and it's all part of it. So are we getting enough funds? I guess the answer is no, but at least the attention is getting there, and at least politicians are paying attention, and hopefully the funds will trickle down.
Anyone else?
I think it's a little important to mention a simple equation. And it goes to the prevention and treatment side. And again, law enforcement, all the kudos for all the hard work they're doing. But if we don't stop the demand, unfortunately, the supply of drugs is not going to stop. These gentlemen, this gentleman in the back, they can do everything under their power and spend a bunch of money doing it. But if we don't stop the demand, we're not going to get very far. And we need most of the funds that are being considered for allocation to be, targeted at that.
Introduce yourself.
My name's Tim. I have a 25-year-old daughter who's been addicted to heroin for 6 years. And living through that, I just want to let people know, I think it is getting better, but there are so many shortfalls. You can't get into a place, they have no insurance, nobody wants to hire them. How many times is a mental illness possibly at the brink of this? Like the officer said earlier, incarceration don't help. 3, 4, 5 stints of rehab don't help. It could be a dual diagnosis, which happens a lot of times. There's an underlying issue. Yes, there's addiction, but after you've treated the addiction and the voices in their head come back again, well, maybe it's not addiction. Maybe it's some sort of a bipolar thing. Why don't we start working through the judicial system to, instead of putting you in a rehab place, start looking for mental facilities to be able to diagnose these people. It could be dual diagnoses and treat them, because, they go in and out, and then they're either in the justice system or they end up dead. And, these kids, they're young people, a lot of them. And I can see the hurt in my daughter's face. She wants it. She's in jail right now, Warren County, and they're talking about the Vivitrol and, the lockdown. Well, what if she has no place to be locked down at? Me and my wife, really, we can't take it anymore. We're about to have a nervous breakdown. Where are you going to lock them out on house arrest if they have no home to go to?
Judge, I'm going to send this one to you.
Well, there are several things that I think are key to focus on. One of them is recovery housing. It's essential. I was in Washington, D.C. Senator Portman's a real leader in this area of tackling this problem. There's a man from Akron, Ohio, who had been to prison 6 times. The judge decided to give him a chance for treatment. He went through treatment, but then he was faced with going back to the same environment that he was in, the same people, the same place. He was fortunate enough to get into a 90-day recovery housing project that permitted him to save money for an apartment, and it saved his life. Now he has a degree from the University of Akron. He's a recovery coach, and he said that recovery housing made the difference for him. It's extremely important. The other thing that we all have to accept responsibility for is the laws that we have. Right now, I think there are probably a lot of people in recovery here who would agree with me that the biggest impediment to recovery is the inability to get a job. So what we've done is we've made a lot of things illegal, from marijuana to other drugs that are much more dangerous. And that's been necessary in some areas, especially for some drugs. But I believe a person who has been in recovery for a substantial amount of time, 2 to 3 to 4 years, and has proven that, has the right to get that erased from their record. Why not? Why should they be tagged with that when they're in? And it's very difficult to do. Right now you can, 1 low-level felony and 1 misdemeanor. But I've had the prosecutor's office object, and that's their job, where a man who's been in recovery has a job, doing well, but needs to get this off his record to advance. He had a possession of a drug that was a low-level felony. He had another theft offense maybe 5 years before that, shoplifting. And he could have gotten that expunged, except he had an open container of alcohol in a motor vehicle 16 years ago that now prohibits him from getting any of those expunged. We have to give the judges some discretion here and look at this picture as a whole. Someone who's been in recovery 5 years, they deserve a second chance.
Dave Logan with Prospect Recovery House. We talk about the recovery house need. Do we have enough recovery houses out, and can we spread them across to the point where if there are people who are desperately looking for them, they can get in?
We don't have enough. There's no question about that. In the state of Ohio, for every 10 people that need help with addiction, 1 is getting help. And if we had the same kind of record with HIV or tuberculosis, there would be an even greater outcry than there already is. And I'm glad to hear the outcry beginning to build. But people would say, my goodness, that's a public health problem. And of course, that's what we've been saying about this particular thing for a very long time. And I'm very happy to hear the judge. I've been saying the same stuff for a long, long time, that back in the 80s, where there were between 5 and 6 times as many people. We've got 5 to 6 times as many people locked up now as we did back then. And I don't think anybody feels that he's 5 to 6 times safer or feels more secure, or that somehow we're 5 or 6 times closer to getting a solution to the problem. So we're spending a lot of money, but I think, in my opinion, we're putting it in the wrong place.
All right. Dave, thanks very much. Appreciate it. Appreciate you being here. And Jeanette, I know you're monitoring Twitter and Facebook. Anything lately?
We do have a few comments. They're pretty good comments. One comes from Susan Munyon. You can look at this up on your screen. She weighed in on Twitter. She said, this addiction is at epidemic proportions. Educate the addict, not just the community. Open more treatment centers. The next one comes from Margina. She says, I'm all against heroin, but some of us need pain pills for the pain. And then lastly, this one's representative of a couple of comments that have been made both on Facebook and Twitter. And this one is a question asking, is legalizing marijuana a mistake when it comes to the heroin epidemic? And obviously some people have some feelings about that one. Of course, want to hear your questions and your comments. Weigh in on Twitter and Facebook using the hashtag #YourVoiceYourFuture.
Before we get to our next person in the audience, I'll let you, John, I'll start with you on, is legalizing marijuana a mistake and leading to greater problems?
Legalizing marijuana is a huge mistake. I think you'll find if you ask recovering addicts, where they got their start, and a lot of times it's been marijuana. But I think probably the thing to look for the most is, if you want to predict what's going to happen in the state of Ohio, look at what's going on in Colorado. And look what's happened with the fatal auto accidents and the juvenile exposures. And there's tons of information from the Rocky Mountain HIDA that will tell you that I don't want to see that happen in Ohio. I don't want to see my kids and grandkids subjected to it. I think it's a huge mistake.
All right. I want to let everybody know we're in a bit of a hurry up. I'm so thrilled that everybody stayed, but we're in hurry up. I know that everybody wants to get to it. I apologize if we don't, but we're going to go in hurry up mode. We got about 15 minutes before we shut it down. So Candy, tell me what you're here for.
I would like to know, I want to go back to the Vivitrol. Apparently there is a drug that you can get at Walmart that's like a generic form of Vivitrol. It's called naltrexone. It's a pill you could take, and it supposedly only costs $34 to $38 a month. Has anyone looked into this, or is this possible?
Anybody have any idea about this?
Well, here's the expert.
I guess, yeah, I'll speak. I mean, the fact of the matter is that it's exactly the same drug. It's just the brand chemical versus the brand name Vivitrol. And the Vivitrol is an injection. It's a 30-day duration approximately. The problem with the daily pill is that studies have shown that the addiction patients just don't take it every day. So if it's a decision that they might make that day, or maybe not a decision, they may not take it that day, and the efficacy is just significantly reduced. So it has not shown the same efficacy. In the limited, although effective trials of Vivitrol, they have not shown to be equivalent.
Because of the discipline?
Because of the discipline and the daily dosing, et cetera,
All right.
Yes, correct.
Okay, well, if they've been taking their Vivitrol shots for 6 months, you said it was an 18-month program, I believe you said. Say you've got someone on there that's for 6, 8 months that has proven themselves, wouldn't you want to maybe try and switch them to that?
So it's a good question.
Because they've showed that they want to,
Right.
do this.
Let me.
Okay.
Well,
We'll address this, and we're going to need to move on.
Quickly, the issue really is wraparound services, right? This is not as simple as a pill or an injection. And furthermore, the answer is we still have a lot of work to do in this field. So I don't have the answer, just to Commander Burke's point. I mean, I have some answers, but we still have a lot of work to do.
Okay, thank you.
Candy, thank you. Step on up. We're going to try and motor through. You are?
Cheryl, just a concerned citizen. But my question comes from the same point of the gentleman over there. The people that are associated or know a drug addict, how do we protect them? Because drug addicts will do whatever they have to do to get that next fix. And, you know, a friend of mine and I have reported dealers, buyers, users, heroin houses. They still do business every day. He watched a dozen transactions on a house on Saturday, called the police in Hamilton County, didn't see one police car drive by. So how do we protect the innocent victim when the addict is calling, texting, calling your work, doing those kinds of things, and you happen to be in 2 different counties, which you said it crosses county lines, be in 2 different counties? How do we get the counties to work together to make sure that that innocent person is protected rather than being harassed, even when they have a protection order in place?
Who wants it?
First, I want to let you know that the county law enforcement and this Southwest Ohio work together very, very well. We work a lot with Hamilton County, Claremont County, Butler County, and Kentucky, absolutely. It's not we realize the county lines mean nothing to those that want to sell these drugs, and so we work together. We actually have a combined task force of the 4 counties in Southwest Ohio. We target actually the money that goes back to Mexico. So there's a lot of things. I know it's frustrating, but the bottom line is the complaints we get, you just cannot handle them all. And they're where maybe you need to be at the right place at the right time, and you can't always be there.
Okay. I know that you're trying to move on, and I understand that.
We won't be able to hear you. I apologize.
That's fine. What I want to know is, after this is over, could I talk to you for just a few minutes? Thank you very much.
Thank you very much. All right. Sarah?
Yeah, hi. I've got a lot of things to say, but not that much time. My son is a heroin addict, and I'm also a nurse in a recovery room. So I give lots of opiates on a daily basis. But what I just wanted to get out to the people is I think that we need to have a task force to bring all of us together and try to fight this. because so many of our youth are dying and suffering. And, you know, I think that we need to all get involved in this. You know, even if we're not involved directly, I think that we should get involved in the community and everything, because it's a mental health issue. The gentleman that spoke before me, you know, he was right on it. It's like, it's a dual thing. It's not just an addiction. Underneath, there's an underlying problem. And the problem is that there's mental illness out there because of depression and all sorts of things. And the help out there for mental illness is, it's really not good.
All right, Sarah, thank you very much. I think that's what we're doing is trying to get everybody here together. Introduce yourself. I'll let you.
Hi, Brett. I'm Ann Barnum from Interact for Health. And I will tell you, Sarah, we have a program. We have things for you to do. There are groups in Warren County, Clinton County, Claremont County, Hamilton County, Northern Kentucky, Indiana, Brown County, Butler County, all addressing this together as task forces. We are doing this in this region. We are known across the country for our collective impact, for the things that we can do together. And together we can stand united against opiate abuse and heroin.
It's not just in Cincinnati, it's a nationwide problem.
Right. Yeah, absolutely.
It's not just here.
It's
not here.
It's not just here. It is nationwide, and I think we know that. I think what you're trying to say is, as we're saying, we're gathering here, everybody's interested. Maybe part of the problem is people are sitting on their backside and saying, somebody come help me. And the things are out there, and people get off their backside, pick up the phone, call a friend, look in the book, find out something, because you can Google anything now. There may be some help out there.
Absolutely. There's help. At Interact for Health, we've just funded 4 different planning projects to form task forces in various parts of our region. And we had a summit 2 weeks ago that we had over 200 people there, and at least 150 of those people stood up, united, against opiate abuse and heroin.
Name of your group again?
The name is Interact for Health, and my name's Ann Barnum, and if anybody wants to get involved, please Google me and contact me.
Outstanding. Ann, thank you very much. All right, next, very quickly.
I'd just like to thank Channel 12 for coming out here and doing this. Thank you, panel. It's much needed. They say there's 1 out of 2 or 1 out of 3 people that know an addict. So why isn't this place packed out? I don't understand it, okay? It's a big, big problem. My daughter's an addict. I'm a 12-year recovering addict myself, okay? She got wrapped up in that stuff, bad choices. But the bottom line is we were looking for help for her, and we had to go down to a Kentucky house because of either what we heard about some of the recovery homes here in this area with drugs being passed in, or we just simply couldn't afford them because it's an outrageous amount, okay? Unless you're under new Obamacare, maybe the Medicaid's changed now, and if you live out on the street, you can actually get the treatment. But if you work for a living like I do, you're going to be paying for quite some time if you want to try to go through one of them places, because they don't take the insurance. So that's a big problem too to address, okay? But my problem is I got a big problem now. She came home from a 30-day quick program, and we were on the right track, and she wanted to get healthy. She wanted to be sober. She couldn't find a job. She was spending too much time at home, okay, and didn't have a place to go to. Maybe that's ignorance on our part. We didn't know if there was places she could go to interact and stay engaged. The gentleman mentioned demons, spiritual side of this. Okay, it's true. And I believe now it was working on her while she was spending that time at home. We had a burial for my daughter 18 days ago. Okay, it's for real. I know I'm still cut and bleeding from it. But I'm just saying that there's transition homes, I think, hold a lot of promise. And I can walk in the county library or other places, and I see cops there in a very non-hostile environment. And maybe we could have some cops going to these places where people are recovering, and there might be a threat of people coming in trying to sell them drugs. But I'd say we need more transition homes in Cincinnati, places for them to go and speak with a counselor or be with a group in therapy.
No question. Thank you. I'm so sorry for your loss. We're running very short on time. I want to kind of throw this out. If we take one thing away from this, Dr. Ryan, as we're dealing with this medically, what's the one thing that we could say medically that we've got to change tomorrow?
I think we need to let everyone understand that it is a true disease, and that this is not a 30-day problem. You know, this is a disease which requires intense efforts, both medical, social support, and everyone needs to understand that it can take a while to recover. So, you know, I feel very strongly for the patients and the families that are involved with this. It's going to be a long ride for most of you. So.
Jeff, you've got something new out there as far as recovery goes?
Yes, I run a recovery yoga studio, and it's all about finding freedom, mind, body, and spirit. And it is a spiritual disease, and it also affects the whole family. We're going to try to start a center that has a place for the children of the addicts, because the families get just as destroyed as the addicts themselves, and they need help and they need counseling, and it's not being addressed, and then so they watch the parents use and they end up using. So we're going to try to address that, and also giving a place for addicts to go to during the day, and have them something to do, a new way of life, and finding a spiritual connection that is so needed to fill that emptiness they have inside, and we're real great hope for that.
Tell me where this is. What's the name of the group? How could people get involved?
It is True Freedom Recovery Yoga. We're at 2025 Dunlap Street downtown right now. We're out ready to get looking for a new place, a bigger place.
Give me the name again, because people will go, I was looking for a pen.
True Freedom Recovery Yoga, 2025 Dunlap Street, down in over the Rhine.
Cost is always an impact. Is there a cost?
It's all donation.
All donation. All right. Jeff, thank you very much. I appreciate it. Sir.
My name is Thomas Barton. I'm a recovering addict of 60 days. I'm in Shores Treatment Center in Port St. Lucie, Florida. That was the best place I went because it got me out of Ohio. And I've been in prison twice myself, and I've seen COs bringing in drugs, tobacco, me bringing in drugs, tobacco. My question is, what are we doing about the COs and the police officers that are dirty, bringing in drugs, letting people bring them in, and all this stuff? It's just ridiculous. All you gotta do is look at their bank statements, or look at how much money they're spending. They don't make that much money.
Small number of people that we're talking about in this category?
Oh, absolutely. I mean, there's bad apples in every profession and every area, and we certainly, if we find out about something like that, we're very aggressive. We did some things the Drug Task Force did with some of the COs some time ago, not in Warren County, but within our county, but not Warren County, and so we're very vigilant when that comes up, and sometimes we need people to tell us so that we can look into these things too. But I mean, we certainly don't condone it.
Brad, really quickly.
Dr. Samarco, yes.
We've been working with the Hamilton County Sheriff's Office for exactly that problem, and we've been helping them test material that comes in for drugs, and random testing and random searches, trying to identify who might be bringing the drugs in. So it's a problem that we're aware of, and we're trying very hard to address it to prevent that. And we know what you're saying. There are, as he said, a few bad apples. We acknowledge that. We're really trying to weed them out.
Why aren't we using the the X-ray machine because people's bringing it in, swallowing it, and putting it in their anus. That's a big.
So I can answer that question. I'm a radiologist. I read X-rays, and most of that stuff does not show up on X-rays unless it has metal fragments in it, foil around it. You're not going to see it on an X-ray.
Okay.
Even
We're going to have to
absolutely
stop
not.
here. We're going to have
No.
to stop here. We began an hour and a half ago with Jade. The road has been long. I was thrilled to be able to meet your wife, your parents. Can you wrap this whole thing up an hour and a half later with the struggle that continues for so many of us?
You know, it does get easier. You know, the struggle in the beginning, it's really tough. It's a struggle, recovery is. But you know, they say, and I was talking about this with a guy earlier. They say that you know, getting clean's the easy part, staying clean's the hard part. And for me, the longer I go, it seems like staying clean is getting easier. I know it was really hard to get clean. But, you know, I think, you know, things like this, bringing awareness, you know, getting the issue out there, I think it's a great thing. I've heard a lot of really cool things tonight, a lot of inspiring things tonight. I continue to be inspired in recovery, and, you know, so I really don't know what else to say, but I'm really happy to be a part of this. So.
Jade, thank you. I appreciate you sharing your life with us. Big thank you, Dr. Samarco, Commander Berkey, Judge Peeler, Dr. Ryan. Thank you so much for your time and for all that you are doing. I want to thank Dave Logan for being with us as well. I apologize that we didn't get to everybody, but my thrill is that you were all here and a part of it. The conversation continues. I want to thank everybody else who was involved, and we hope that this is just the beginning. This isn't just talk. This is something that we will carry on, and Local 12 wants to be a part of changing hopelessness to hope. Thank you for being with us tonight. Good night, and we'll see you again next time.